Welcome to Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black South Florida community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
Thank you so much for joining me today, and welcome to Black Health, a platform to discuss illnesses affecting the Black community. I am your host, Dr. Michelle Kirwan Blythewood. I'm a board-certified pediatrician and the Chief Medical Officer at the Pediatric and Family Health and Wellness Center in Miami, Florida. And today we are talking about oral health care and the social determinants of oral health with dentist Dr. Dana Walker. Dr. Walker, welcome to Black Health.
Thank you. Thank you so much for having me on your show.
Absolutely. I'm going to take a brief minute to introduce you, if that's okay. Dr. Walker is a general dentist at Jesse Trice Community Health System. She completed her dental training at the University of West Indies. She continued her training by completing a 2-year advanced education in general dentistry residency program at NYU Langone Hospitals, hosted by Jesse Trice Community Health System, where she was also the chief resident. Once again, Dr. Walker, welcome.
Thank you.
So let's jump right in. Why is oral health so important for overall health and well-being?
Well, our oral health overall is a part of our general health. And I think oftentimes we tend to forget that small but important fact. And so if we're able to maintain good oral health, we're able to help to maintain other systems in our body. For example, heart disease has been linked to periodontal disease, which is a type of gum disease. Diabetes control has also been linked to oral health. So we see that there's certain once our oral health is intact, we see how those things that can actually help and influence our overall health.
I think it's so important to make that connection, because a lot of people don't realize how our oral health affects our dental health. Our medical health, and vice versa too. So, what are the most common oral health issues you see in your practice in children and in adults?
The most common things that we tend to see are gum disease, and we see a lot of cavities. And with those things come pain, stress, and it creates a sense of pain. And with pain, we know pain creates other issues. And so we tend to miss work or school, and those things can also influence other parts of our lives. We also see oral cancers, oral lesions. And so oral health is not just teeth. And I think that's something that is a really important fact that oftentimes people tend to forget. So it's really important to see your dentist twice a year, at least, and to get your regular checkups, so that if there's anything that's going wrong, we'll be able to spot it early and do early intervention to prevent it from getting worse.
Are there oral health conditions that disproportionately affect Black people, like gum disease, or you just mentioned oral cancers?
So what we've seen is that we know that heart disease is very common in the Black community, and diabetes. And due to the link between those two things, oral health and these conditions, we see that those, just a bit of background, with heart disease, we know that the bacteria that can populate our gums can travel through the system and actually deposit plaques in our hearts and create an increased risk of heart problems. With diabetes, another thing that research has shown is that when we do not control the gum disease, the glycemic index is actually not as well controlled. And there's a bidirectional relationship between the gum disease and the blood sugar levels. So if we can keep the gum disease under control, what we've seen is that the glycemic control tends to be well controlled. But also the other side is the same. If the blood sugar isn't well controlled, we can see that can also lead to a not well controlled gum. We're able to see certain habits early, and we're able to help them to understand the importance of improving on those habits. And if you can improve the habits of a child, you can change their trajectory of their life and hopefully the trajectory of the generations to come. And that's why I think with children, it's so important. But particular misconceptions are that baby teeth are not very important.
Yes.
And each time I hear patients or parents saying that, I use it as an opportunity to help to educate them of the importance of baby teeth. Baby teeth are there to help to guide the adult teeth into the correct position. And so we want to make sure that we maintain them for as long as possible to help to prevent crowding and to help to prevent premature loss of baby teeth, which can come with their other host of issues. The other thing is that some parents may feel that because a child is young, they don't need to have exams. It's recommended by the American Dental Association that children should have their first exam by 6 months or within 6 months of the first tooth appearing in the mouth. And so it's very important that parents really try to stick to those guidelines because, again, if there's anything that's happening, we're able to spot it early and we're able to then intervene quickly before things get worse.
So I'm a pediatrician, and one of the things I see is that parents don't understand that they need to get that first visit in early. So tell parents watching now, what is it that you do at that 6-month visit that they need this visit or the first tooth visit?
So with that first visit, there are several things we're looking at. With dental health, we're not just looking at teeth, we're looking also at the facial structures. So we're looking at the bones, how the bones, the maxillary and the mandibular jaw, how they articulate. We're looking to see things like tongue ties. So those are what we refer to as frenal attachments of how the tongue is positioned. And those things, just having an idea as to what's taking place in terms of feeding habits. Is a child falling asleep with milk in their mouth? That's a habit that we really do try to discourage because once that happens, it increases the child's likelihood of developing cavities, which can lead to pain and, again, premature loss of baby teeth. So lots of issues.
Thank you for that. I think that's very necessary. We do need to run to a quick commercial break. You are watching Black Health, sponsored by the Health Foundation of South Florida, and we will be right back with Dr. Dana Walker and more on oral health care.
The Family Expo is back, and you don't want to miss it. Get ready for a day packed with fun and resources to help your family gear up for back to school. It's easy with an Uber voucher good for up to $15 each way. Join us on July 27th at Florida Memorial University and August 3rd at Miami-Dade College Kendall Campus. Visit thechildrenstrust.org/Family Expo for details. Uber voucher terms and conditions apply.
Hey Miami-Dade, the August 20th primary election is approaching. Register to vote or change your political party online or by mail no later than July 22nd. Visit miamidade.gov/elections or call 311.
There are many ways the cancer journey can make you feel. But when you're surrounded by supportive experts that deeply care, you'll see that this personalized journey wasn't just designed to make you feel better. At Baptist Health Cancer Care, we designed every aspect of it around research to make you feel well. Welcome to Breakthrough Cancer Care.
Experience the heart of HBCU culture at the Orange Blossom Classic. This Labor Day weekend, Miami Gardens transforms into an HBCU homecoming you don't want to miss. Catch the matchup between North Carolina Central Eagles and the Alabama State Hornets on September 1st at Hard Rock Stadium. But there's more. Enjoy a full lineup of events like the Battle of the Bands and Fan Fest. Tickets start as low as $25. Get your tickets and book your hotels now at orangeblossomclassic.com. Be a part of something unforgettable.
Grew up down here in South Florida, so for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters, because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866 954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
Welcome back. You are watching Black Health, sponsored by the Health Foundation of South Florida. And we were speaking about oral health care with Dr. Dana Walker. So, Dr. Walker, I want to switch gears and talk a little bit about the social determinants of health, of oral health. We'll start with, can you explain the link between lower socioeconomic status and higher rates of dental caries and periodontal disease or gum disease?
Sure. So, social determinants of health, just for a bit of background, it has to do with where we're born, where we live, where we work, and all those things have an impact on our access to care. So, our social determinants of health can impact cavities or the risk of developing cavities or risk of developing other oral conditions. So, we see a link to particular zip codes also in terms of the likelihood of mortality. And so all these things do impact health. So, just a bit of an example. If an individual lives in an area where there is not enough access to nutritionally dense foods, what we find is that persons in those communities tend to eat foods that are more sugary, like more sugar foods. And so the more sugars that we eat, the more juices that we drink, the more sodas that we drink, the more likelihood we will develop cavities. Also, based on where the access to care, if we live in an area where it's far from being able to access care, people are less likely to attend visits, dental visits. So, access has to do with location, it has to do with transportation, it has to do also with persons where they work. Persons, if they work in a job where they're not able to have dental benefits or they're not able to have time off, those things affect persons' ability to be able to access care. And we also see that depending on where a person works and their educational level, persons may not be able to have the time. It may seem so easy to say, okay, brush twice daily and to floss daily. But sometimes persons just really do not have the time. They're so stressed trying to make ends meet, trying to put food on the table, that sometimes, to be honest, brushing, they may get home and they're so exhausted from the day. It's just hard to just say, put this new routine in. So we have to be really sensitive to things like that and how those factors can impact health, oral health, and health overall.
How about, you mentioned as a social determinant of health where we live. So can you talk about the impact of neighborhood environment on oral health, like the availability of fluoride in the water or the presence of a dental clinic in the neighborhood?
Right. So, certain communities do have fluoridated water. And what we've seen is that when a community has fluoridated water, if individuals are drinking that water, it does decrease their likelihood of developing cavities. So that's a good thing. But if they're not drinking the water, then they're not gaining that benefit. We also see that in communities where persons have access to care, so if there is a health center that's located within the community, it allows persons the ability to be able to be more likely to go to get access to care. Transportation, from a transportation point of view, from time wise, we know we live in a society where time is of essence. And so if you're able to get to a place in a shorter period of time, you're more likely to be able to access that benefit.
Do disparities exist in oral health outcomes between Black adults and kids and their peers from other racial or ethnic backgrounds?
Yes. It's a sad thing to say, but yes. It is really, I think a huge part of it has to do with trust from the patient's point of view. If patients are not able to access care from healthcare providers that look like them, that have similar experiences to them, and that are able to identify with them, what we see happening is there's a disconnect. And so, with that disconnect, it's hard to reach the patients and it's hard to get them on board with certain plans that um, would be great. So, the important thing I think is trust, and being able to build that relationship with patients and being considerate, being compassionate, being understanding, and just really, really trying to develop that relationship.
So you work at Jesse Trice Community Health System. How do you address these disparities and social determinants of oral health in your practice? And I know you do, as you're a federally qualified health center like we are. So tell us a little bit about that.
Yes. So, as an organization, we do have several services, social services that are available. We have outreach programs. We do have certain programs that help with financial assistance of patients. We do have programs that help with housing assistance. And so, one thing I really do love about Jesse Trice is that they have all these different programs in place. And so, when patients come in, and if there's a need that is identified, we have different resources that we're able to help to guide patients in order to learn, to teach them, or to help them to access these benefits that are available to them. And I think, just to answer the question, also as a clinician directly with patients, it's very important to speak to patients and to be able to not judge, not try to come across as judging, to listen. I think it's really important that we have to listen, and not just listen to speak back, but listen to really hear what patients are saying and trying to understand where they're coming from. Sometimes patients may come and they're frustrated with stress. The economy is not necessarily the best. Some persons are experiencing home insecurity, food insecurity. And so, really listening to what patients are saying, trying to help to identify what issues they may be experiencing, and trying to be compassionate, trying to go out of I try to go out of my way to help where I can, and if I can, to help to direct them to any resources that may be helpful for them.
What about patients who don't have dental insurance that come to Jesse Trice? How are you able to assist those patients that are uninsured?
So, patients that come to our location that are uninsured, we do have a sliding fee scale. And so, when patients come in, once they check in, that's one thing that the or customer service representatives, also known as CSRs, they're able to help to communicate with the patients various payment plans and sliding fee scales. And also, if patients really just cannot afford um, to make a payment, we do have grants. So we've been very fortunate to have access to various grants. I do know that we have the anti-poverty grant that was provided. So we do have that grant. We do also have the Dental Quest grant. And so we are able to help to use various grants to help patients that really are not able to afford the treatment.
That's excellent. And it's a good thing these grants exist, because even as you mentioned with the sliding scale, even as little as it might cost, there are patients that's out of reach for, especially perhaps the homeless population. So we do need to take another quick commercial break. You are watching Black Health, sponsored by the Health Foundation of South Florida. And we are here with Dr. Dana Walker, general dentist at Jesse Trice Health Center. We will be right back after this commercial break. Don't go anywhere.
The Family Expo is back, and you don't want to miss it. Get ready for a day packed with fun and resources to help your family gear up for back to school. It's easy with an Uber voucher good for up to $15 each way. Join us on July 27th at Florida Memorial University and August 3rd at Miami-Dade College Kendall Campus. Visit thechildrenstrust.org/Family Expo for details. Uber voucher terms and conditions apply.
Hey Miami-Dade, the August 20th primary election is approaching. Register to vote or change your political party online or by mail no later than July 22nd. Visit miamidade.gov/elections or call 311.
There are many ways the cancer journey can make you feel. But when you're surrounded by supportive experts that deeply care, you'll see that this personalized journey wasn't just designed to make you feel better. At Baptist Health Cancer Care, we designed every aspect of it around research to make you feel well. Welcome to Breakthrough Cancer Care.
Experience the heart of HBCU culture at the Orange Blossom Classic. This Labor Day weekend, Miami Gardens transforms into an HBCU homecoming you don't want to miss. Catch the matchup between North Carolina Central Eagles and the Alabama State Hornets on September 1st at Hard Rock Stadium. But there's more. Enjoy a full lineup of events like the Battle of the Bands and Fan Fest. Tickets start as low as $25. Get your tickets and book your hotels now at orangeblossomclassic.com. Be a part of something unforgettable.
Down here in South Florida. So for me, it's a little bit more personal.
For the Mesman and Dover Law Firm, it's about community.
For us, South Florida's our home. You all are our people.
Our family, our future.
The difference we'll make for you, your loved ones, your kids, matters. Because to us, it's personal.
If you need us, call us 24/7 at 866-954-MORE.
That's 866-954-6673. Demesman and Dover Law Firm, youraccidentattorneys.com.
Help comes in many forms. As a Miami-Dade County bus operator, you can help your community, help those in need, and even help yourself. Operators have the opportunity to earn more than $50,000 a year plus built-in overtime, earn more than 13 paid holidays and vacation days, and take advantage of the tuition reimbursement program. Plus, qualified new drivers will receive a $5,000 sign-on bonus. Become a driving force in our community. Apply now at miamidade.gov/busdriver.
Welcome back. You are watching Black Health. We are talking about oral health care and the social determinants of oral health with Dr. Dana Walker. And Black Health is sponsored by the Health Foundation of South Florida. Welcome back, Dr. Walker. So in the last few minutes of our show, let's talk about some preventive tips that you can give for adults, for children. What can parents, adults, children do at home to help prevent caries and prevent gingivitis and gum diseases, periodontal disease? What can they do?
So definitely brushing twice daily, flossing. It's very important that persons brush, especially before bedtime. Oftentimes, we always hear brush twice daily, but the most important time to brush is right before bed. Because the thing is that if you fall asleep with all the food from the day and your salivary flow, which naturally decreases at night, if it's not present, then you are at increased likelihood of developing cavities. Also with flossing, brushing can only clean half of the surfaces of your teeth. Flossing is what cleans in between your teeth. So it's really important to have both. So the flossing also helps with the gums. So definitely that's important. Decreasing sugary intake, decreasing juices, decreasing sodas, increasing water, increasing nutrient dense foods. The more foods that we eat that are nutrient dense, the less likely we will be reaching for anything that's sugary. So that's something definitely that we should we try to encourage. Also, it's really important to have that medical dental integration, because oftentimes what we see here at Jesse Trice is the physicians refer patients to us. So patients who have diabetes, patients who have high blood pressure, particularly, they'll refer the medical department, they refer patients to us to help to have that medical and dental relationship going. And it helps to educate the patients about that. And then we also have our pediatric physicians. They also refer patients to us because we want to try to get in as quickly as possible. We also have an OB department. They refer their matters to us because we see where gum disease has an increases the risk, of low birth weight and preterm birth. So we want to make sure that we have that relationship between medical and dental.
Very
Those
interesting.
things really important.
Yeah, it's a very interesting link between maternal health and dental health. I don't think people really think about something like that their oral health can affect the outcome of their pregnancy. So that's pretty significant. So what final advice do you have for our listeners? You gave some great advice there. Is there anything else, any last tips that you want to give? And also, before we finish, please tell our listening audience where they can find you if they want to come and get their teeth cleaned and their oral health care from you at Jessie Trice.
So last tips, definitely see your dentist at least twice yearly. Very important. Again, just to help to, if there's anything that's wrong, we will be able to identify quickly and then we'll be able to intervene before anything gets bad. In order to get to me, so I am here we have our website. It's jtchs.org. So any information that you would like to find out about Jessie Trice, it's right there on our website. We also have access to all different healthcare providers, and so you'll be able to find all that information on our website.
Excellent. Well, thank you so much, Dr. Walker, for joining us today and for bringing your knowledge to our listening audience. We appreciate your time. We know that you are a very busy dentist, so thank you so much for joining us. And for those who are watching, thank you for joining us on Black Health. We are sponsored by the Health Foundation of South Florida, and we will see you next time. You can also follow me on IG at Black Health Show. See you next time on Black Health. Have a great week, everybody.